Welcome to TVC's Sunday Specials. The World Health Organization, WHO, says no fewer than 150,000 children born in Nigeria carry sickle cell disease, one of the world's most common genetic disorders. In this feature story, TVC News' Ikenna Amaechi follows the work of one team whose effort to ease the pain for sickle cell sufferers got recognized at this year's United Nations General Assembly.
Up to 16% of under-5 mortality cases in Nigeria are traced to sickle cell anemia, with nearly 3% of the country's population affected. Mr. Victor Nwabudike Okosa and his wife in Okpanam, Delta State, so blessed their 4-year-old son is a sufferer.
My wife has 5 genotype results showing she's AA. I had just one test result. We were just satisfied at that. Not until recently, after we had our first son, I found him to be very sickly. We started going to the hospital too frequently. After some time, the chief pediatrician in FMC suggested that we do a genotype test. We were like, where is this one from? But at the end of the day, her result showed that she's AS. We are amazed. In fact, it was heartbreaking for us.
It took years of struggle before they discovered his condition, but found the cost of managing it too high.
We are heavily indebted before now because of him. From July last year, when we found out the date, we spent over £1 million on this guy.
Whenever we're on admission, we go to FMC and we know how much we spend. We spend a whole lot of money.
In June, fortune smiled on them when an NGO intervened.
The Sickle Cell Referral Center here in the Specialist Hospital, Asaba, has been of great blessing to our family.
Because if she had not done that, people like us that go to FMC to spend almost 100,000 and all that, there will not be hope.
With its state-of-the-art equipment and combined team of genetic counselors and medical doctors to attend to patients daily, the Nwabudike Okosas are not the only beneficiaries.
Since we started coming to the center, we've come to realize how to manage it, because before, when she started having crisis, we used to think it's one big sickness, when we've not come to understand that it's sickle cell that she's suffering from.
There are other centers established in government-owned hospitals in Agbo, Ole, Saple, Kwale, Okwe, Ugeli, Otu Jeremy, Umonede, Iseluku, Patani, Eku, and Koko. The O5 initiative is the brainchild of the wife of the Delta State Governor, Mrs. Edith Okowa.
O5 initiative, as you may be aware, is a non-governmental organization inspired by the teachings of our Lord Jesus Christ. Our mission is to feed the hungry, provide shelter for the homeless, clothe the poor, care for the sick, and visit the prisoners.
Though the NGO carries out other humanitarian services to help indigent people, it is their care for those battling with sickle cell disease that caught the attention of organizations at East's 74th Ordinary Session of the United Nations General Assembly.
All these activities formed part of our presentations at the just concluded United Nations General Assembly. To the glory of God, our modest effort in tackling the sickle cell disorder caught the interest of organizations and individuals who were motivated to do same in their respective countries.
It was there the O5 initiative attracted interest from the Initiative for Global Development, a US-based organization founded by Bill Gates Sr. in 2003.
A major outcome of our UN presentation is the expressed desire of the Initiative for Global Development to partner with O5 Initiative. Their interest is centered on digitizing our sickle cell clinics across the state. This will generate critical data that will aid in the management of sickle cell patients.
Given its reach and the size of its work, the O5 initiative is now looking to take up a life of its own. One reason the disorder has persisted is the lack of adequate enlightenment.
For young couples, the most effective way is to find out your genotype on time.
1, 2, 3, 4, 5.
So blessed, who hopes to become a medical doctor someday, happily does his homework with assistance from his mother. The care for people with sickle cell disease may include infection prevention with vaccination and antibiotics, high fluid intake, folic acid supplementation, and pain medication and blood transfusion. A small percentage of people have been cured by a transplant of bone marrow cells. Have come to terms
with the ailment and the management of feet
and advise those who have sufferers like themselves
to actually embrace the ailment and try to see a way to stick to the rules and regulation and they will have a normal life. Ikenna Amaechi, TVC News, Okpanam.